Thank you, Mr. Chairman, and I also want to thank you for tackling a very difficult challenge often in this committee. And while I have concerns about rollout that are, I think, have been extended actually or not addressed as effectively as it could be from last year, I think we're all in a better place given that this is a much smoother rollout. But I want to hit, if I can, three things. One, the Affordable Care Act deals with cost not just by making some transformations to a fee-for-service environment, but just by having more people covered and lowering uninsured and uncompensated care costs. You know, we have that shift, which is great, but it didn't do enough, in my opinion, to deal with quality or cost. So we're going to have to continue to get people insured, and we're going to have to continue to deal with real cost issues and real structure issues in the way in which we reimburse providers and incentivize patients. Given that, in our state, New Mexico had one of the lowest or highest uninsured populations in the country pre-Affordable Care Act, and we're doing better, but we could do much, much better. And in fact, given our large Hispanic population, which continues to be a real challenge across the country, Ms. Taffeter, can you talk to me a little bit about what you're doing better about outreach and transparency and communication and education, because the Hispanic demographic, as I understand it, was the lowest. We didn't penetrate that population in terms of increasing coverage. So what are you doing to specifically address that?
Right. I think for starters, this is something, you're correct, we identified at the end of the open enrollment period last year that this was an area we had not penetrated as deeply as we'd wanted. So we created a work group, and we've gone about it several ways. We've created advocacy groups. We've worked with navigators and assisters to make sure that they are trained. Not only
be specific about that advocacy work. Talk to me about specifically how that would translate to somebody in New Mexico having a better chance for being enrolled.
So let me start with the navigators and assisters in New Mexico. We have done more to ensure that as we made the awards this year, that we were dealing with bilingual staff in all areas, because that's something, and not just a presence, but a significant presence. We have been working through, and I can get you information specific to your state, but we have been working with advocacy groups inside the state to work many times.
I would really encourage you to do that, and I appreciate that you're trying to answer, and I want to make sure that with my limited time I get as much out as possible. I have a suggestion for you.
Okay.
I attended many of the enrollment efforts last year, and you're touching an individual consumer 6 times in New Mexico. You lost them if you have them in the room, get them enrolled. And that's a huge problem, and you're minimizing, I think, the experience that our consumer here today presented. I really appreciate your presence here, that it can and does work. Now we need to make sure that people have that opportunity. The second thing is I really want, as you're getting more people covered, I want us to start exploring, and I'm asking for the administration to work more closely with members of Congress, because while we're seeing access and the exclusion of pre-existing conditions, having that be a barrier to providing coverage, and premiums that are lower in my state certainly, but out-of-pocket costs and deductibles are higher, which means that you still don't get folks who are accessing the health care system even if they have coverage. And while I think most folks still are not understanding that the Affordable Care Act really minimally does anything to insurance companies when we set the floor about who they have to cover, but they make decisions about their provider networks, and they make decisions about what they're going to pay docs, and they make decisions about what hospitals are going to be in their network, and they create that environment. And we're going to have to do more to get them to lower total costs and to create much more expansive provider networks. And I'm encouraging you to be very assertive in that role and work with members of Congress to get that done. And with limited seconds left, the last part is, like my colleague, Senator Langford, Since August and September, we've been waiting for you to respond to New Mexico about behavioral health access. While that's not particularly related just to this hearing in the ACA, it is a transparency issue, and we are looking for numbers. And my understanding is that now another provider has dropped all behavioral health coverage in the southern part of the state, and I'm really encouraging you that while you wait for 3 months to respond, that's 3 months where New Mexicans don't get health care coverage in Medicaid, and I'm encouraging you to take a stronger, more productive role to stop the damage in New Mexico.
Thank you. Will do.